So today is Reimagining Mental Health, and today is an interdisciplinary workshop and series of panels and discussions about incorporating harm reduction and trauma-informed care into multiple disciplines and practices.
I see my job as a nurse to do what I can to help people do what they already know they need to do to survive, and help them do what they're already going to do in a safe way. I think it's really amazing that folks who put this on are doing it, because this is definitely education that I did not get when I was in nursing school here.
I think it's a really great opportunity to also show that there are so many people in Philadelphia that do this kind of work already. It's literally things that happen on the ground all the time, and now communities in Philadelphia are being forced to do it for themselves because the healthcare community refuses to adapt.
The main thing that attracted us to the event is educating providers and really just stress the importance of, in any harm reduction efforts, of having the person in question centered and have the power over their own lives.
We're trying to dismantle cancel culture. We're trying to put into place something called restorative justice, where people who have hurt others have pathways to reintegrate back into the community and make amends with their victims.
There are a lot of misconceptions within the healthcare community and the community at large about sex work and what sex workers need and what sex workers want, and the reality of our experience. So educating around that is essential to helping provide trauma-informed care and harm reduction.
I was so excited about this event because I've been hearing more about trauma-informed care from our social worker team members, and so I've been trying to apply that to the work we've been doing in the ICU.
I think it's important for folks in a position of power, which healthcare providers are in a position of power over other humans, to look at things through an intersectional lens and a human rights framework. So you take into consideration all of the things that shape who a person is.
One of the things that came up, everyone on that panel spoke to, which I love, is that we were all really there to support individuals to find what works for them.
We touched on a lot of different aspects of what we all do. I think we also had an opportunity to learn from each other. For me personally, especially from the death doulas that were on the panel.
I thought the panel went really well. The audience seemed to be really engaged and interested in the topics that we were discussing. And during the lunch, people were really engaged about learning more about what we do.
Everyone here is focused on how to use these principles in our own work, how to make it more employed in the settings that we work in, and also fostering connections for people who approach work similarly.
One takeaway for me was that with all of the work that we do, there is great intersection, and with trauma-informed and harm reduction work, that it can be applied to all of our lines of work.
This is innovation by the community themselves and born out of people being forced to take care of each other because there was no one else that would take care of them. So we're just looking to learn from them.